So, I hope we can see this all okay. And it is 2 o'clock. So basically, let's see. Basically, my name is Danielle Waters. I'm the one of the exercise physiologists at Joint Effort in Old Saybrook, and I am going to be talking to you about your heart health or cardiovascular health today. I want to set this up in a way where you can see everything. Okay, cool. So, to start, a little bit about me. So I got my undergraduate degree at UConn, master's degree at Southern, and I actually, before I found Joint Effort, I was at Middlesex Health Cardiac Rehab for 2 years, actually for the first year, or after the first year that I was in my graduate degree, I was kind of doing both at the same time. But I learned so much about exercise, so much about the heart during this time, and a lot of what I'm going to be talking about today was taught to me by the awesome, awesome nurses that I worked with. So just a little shout out to all of our healthcare people, all of the people on the front lines. I love you guys. Thank you for teaching me all of this. And also, I can't really see it, but I have right here American College of Sports Medicine. I am a certified clinical exercise physiologist. And that is just one of the certifications that I worked really hard to get. So just decided to put that up there. So to move on, what are we going to be talking about today? We're going to be talking about your heart and your heart health. I want to talk about your heart and how it works, talk about the way that your blood flows through the heart, talk about the vasculature of the heart, as well as the electricity that goes through the heart. We'll touch on what a heart attack is, because I feel like it's really important for us to know why we're taking care of our heart, to know what these things are that we hear about all the time in the news from our doctors, etc. And it's just, I feel like it's really important to have this information. That's why we're going to be talking about it. I also want to talk about what blood pressure is and why it's important to manage your blood pressure. Same thing with cholesterol. Cholesterol is probably my favorite one to talk about. We'll also talk about stress and cardiovascular disease, and then I'm going to talk about the steps to improve your cardiovascular health. So I hope it is interesting, and I hope that you learned something. And I did write in the comments, please leave questions in the comments at any point. I can see them right next to the video, so I'll try to answer them as in real time as possible, or at the end. So just anytime you have a question, just write it down. And I'm gonna say hi to my mom because she typed in hi in the comments. So hi, Mom. Thank you. Okay, so your heart and how it works. This one is something I love to talk about. So I like to use a lot of metaphors, and I like to start with your heart is like a house, and it has 4 rooms and 4 doors. It has electricity, it has plumbing, and you need to upkeep it. You need to take care of it. So your the top 2 parts of the heart are called the atria, or one of them is the atrium, and your bottom 2 rooms, they are the ventricles. So the heart actually beats, if you can see this, it beats like this. It goes the top, bottom, top, bottom, top, bottom. So those are the lub dub things that you hear when you're listening to someone's heartbeat with a stethoscope. That lub dub sound is actually the sound of the doors closing. So the doors are in between all of the rooms, and also in between all of the arteries and veins that connect to the heart. So I am just going to show you guys the trail of one little red blood cell that goes through the heart. So this side here, the blue side, that is the unoxygenated blood. It is coming into the right atrium from the rest of your body, and this little red blood cell is going to go through here. The top part is going to squeeze and send our little red blood cell into the ventricle, the right ventricle. Then that bottom part is going to squeeze. Our little red blood cell is going to go out to the lungs. Now, in the lungs, the blood cells actually go into little capillaries that allow the oxygen from the lungs to oxygenate that blood cell. Then it comes right back in to the heart, to that left atrium, and then that top part of the heart squeezes again, goes down into the left ventricle, and this is the side of the heart that is the strongest. The left ventricle is actually what squeezes and pushes the blood all the way to the rest of the body. It goes through the aorta, which is the biggest artery in our body, and that is it has a lot of pressure to push against. So that side of the heart is usually a little bit bigger, the muscles there. And yeah, so that's where one little red blood cell goes when it goes through the entire body, or through the entire heart and gets used. So now what happens if parts of this heart pumping system doesn't work properly? Well, I mean, same thing with a house. You know, your electricity might go out and stuff might flicker. Your plumbing might not work and there's a clog somewhere. Or maybe your door doesn't close all the way and then there's a draft. Those are some of the things that can happen with your, you know, heart system. And we're going to talk about those a little bit today. So going into the vasculature of the heart, this is like the plumbing of the heart, basically. So it's okay that you can't read what it's all pointing to. I just wanted to be able to show you that the entire heart is one big muscle. And that muscle needs to get, it needs to get the nutrients and oxygen sent to it to be able to work. But more importantly than that, it also needs the nutrients and oxygen to be taken, or sorry, not the nutrients, the waste and the carbon dioxide to be taken away from it once it's been used. So that's why we have our little blue veins. The blue veins there take the waste away from the heart muscle, and the red arteries are bringing the oxygen and the nutrients to the oh, I just realized I can see a lot more comments. So hello to everyone. Hello, Mary and Nancy and my aunt and everyone. Okay, good to know. Anyway, sorry about that. I got distracted. So these arteries are you know, super important. So when one of these arteries get blocked, you know, that is when chest pain or a heart attack can happen. So that I just think it's important to know that the heart is actually completely covered in these capillaries and in these arteries. So even though there's a little bit on here, it actually is completely covered. And actually, the more that you do aerobic exercise or cardio exercise, you're actually telling your body to make more of those little capillaries around your heart and actually in your muscles too. So your body will make more arteries, more capillaries to feed more of the muscle that you're using. And I'll talk about that again later too, but that's one of the reasons why aerobic exercise is so important while, to better your cardiovascular health. So I also like to talk about the electricity in the heart. So the way that your heart pumps is that, and I'm going to go back a little bit. So right about here in that right atrium, there's a little cell called a pacemaker cell, or maybe a collection of cells, and that one will fire and it'll send an electrical signal down throughout the entire heart muscle. So that is what, you know, lets the heart pump, or it tells the heart to pump, tells the muscle to contract. So that's going backwards again. Okay, so the EKG that we're looking at, this is probably a really common thing that you've seen, in those medical shows and everything. But what, and as someone that worked in a cardiac rehab facility, I would, everyone that was there, everyone that was a patient there, was hooked up to an EKG machine, and as they were exercising, I would be watching their heart rhythm go across the screen, and I would be looking for anything to tell me if something was going wrong, or if something was going right. So basically here, this little P wave here, this is the actual pump of the atria, of the top part of the heart. So that is the electricity going through that top part of the heart. Here, this really big spike, that is the electricity going through the bottom part of the heart, the ventricles, that really strong squeeze that needs to happen to get the blood to go to your head and down to your toes. And then because it is so strong, it actually has to depolarize. So we can actually see the ventricles relaxing in this T wave. So there are so many things that you can look for in here with this EKG. I'm just going to show two things that I would have been looking for that relate to a heart attack, how you can kind of read what might have happened to someone's heart muscle. Oh, and I went backwards again. Okay, so here is ST depression. I drew it in poorly, so I hope you enjoy that. But you can see here that if, let's say I was watching someone exercise and I saw that, at rest, maybe they looked like this with everything going right back to that 0 line. Sometimes, if there is a little bit of a blockage, or if, there's some lack of oxygen getting to a spot, not necessarily a heart attack, just a little bit less oxygen, we would see ST depression, the that line between the heart's pump and relaxing would be lower than the midline, and that would, it may or may not have symptoms, but that would be something that we would look out for, because we would stop exercise, see if they have any chest pain or whatever. That's just one way to read the EKG to see if anything's going on. Then, this is a minor change, we have ST elevation. So something that you can see with this, it could mean that a heart attack is happening right now. It could also mean that someone has had a heart attack in the past. So I don't know if you can see that little blue line there. It's higher than the 0 line. So I just wanted to show a little bit of what you can kind of read from an EKG and how it's more than you may have thought it was. We're not just making sure the heart is beating, we're making sure it's beating regularly and that, things aren't going out of the ordinary. So now I want to talk about what is a blockage. And this is actually something that was extremely, extremely interesting to me the first time I learned it. So again, I kind of went through it quickly in the beginning, but I got my undergraduate degree at UConn, my graduate degree at Southern, and then I worked in cardiac rehab for 2 years. So I have been teaching a lot of this stuff as well as learning it. And when I learned that if this is your artery, well, so to back up, your artery has 3 layers. It has an outer layer that is basically like skin cells. It has a middle layer that you can kind of see here. It's that thickest layer there. And that's actually muscle. Your arteries have muscle in them. And those muscles can either dilate, relax, or they can constrict. So the middle layer is muscle, and then the inner layer, there's actually a layer on the inside. It's like another skin barrier, and that that layer has a lot of receptors in it that can help to tell the artery if it needs to relax or contract. So when plaque builds up, and again, this is something that I learned and I was like, wow, why don't more people know this? When plaque builds up, it actually builds up between that inner layer and that middle layer. So the inner layer kind of protrudes out and closes off the area of the artery for the blood to flow through. And plaque is basically, fatty substances as well as calcium deposits, as well as even white blood cells. And it is a response to inflammation, and we will talk about that. Let's see. So basically a blockage is when the artery becomes so narrow that blood flow to that area of the heart slows down. And if you've had heart problems, or if someone you know has had to get a stent or bypass surgery, you may remember the doctor saying, oh, there's a 80% blockage here. There's a 40% blockage. Oh, this one's 70%. That percentage is just how much plaque is in there and how small the opening is for the blood to flow through. And then we have heard of like a blood clot or a complete blockage. That could happen if that little inner layer here, the innermost layer of the artery, if that tears or gets way too much damage, and then the plaque, let me back up. If there is a tear and if there's enough damage of the inner layer of that inner layer, then a blood clot starts to form. When you get like a cut on your hand or something, a scab starts to form. So that is kind of where like those immediate really severe heart attacks could happen, is if there's a little tear there. So now I want to talk about what is a heart attack. This is when an artery becomes so narrow that the blood flow to that area stops. No oxygen or nutrients can go to the muscle, and no waste products can be taken away. And something I do want to mention is that when I mentioned earlier, when the capillaries are all around this heart muscle, if you are more cardiovascularly trained, if you do more aerobic exercise, you can actually help those spots that have a little bit of blockage. Your body tries to still feed that area of the heart. So that's one good thing that comes along with exercising and maintaining that exercising lifestyle. It kind of keeps all of this up. But so basically, if you can see here, there's kind of a damaged heart muscle there. So that's basically what a heart attack is. And I went backwards again. So now I also want to talk about what is angina. And this is something that I would talk about with my patients a lot because angina is chest pain. And chest pain doesn't necessarily mean that it's a heart attack. It just means that the waste product is not really able to get away from the muscle and the oxygen isn't able to get there. And people might have chest pain when they stand up out of the chair and start to move, or while they're exercising, or when they're shoveling snow. And I'll talk about that later. I don't want anyone shoveling snow. But again, chest pain does not always mean that it's a heart attack. It can go away. But if you do have any of these symptoms, it is extremely important that you talk to your doctor or call 911 if it doesn't go away, and take care of that immediately. You need to take care of yourself. But anyway, so these are pictures of where you might feel chest pain. And I was really happy I found a screenshot of the paper that we would use when I was working at that cardiac rehab center all the time. I found a screenshot of it online. So you can have it to the left of your breastbone because your heart is in the left side of your chest. But this chest pain could be all across your chest. It might be only in the middle of your chest or in your neck and jaw. It could be down your arms. It could even feel like indigestion, or it can be in your upper back. And it might not even feel like pain. It could feel like pressure. I know I had a lot of patients that said it felt like there was an elephant sitting on their chest. It just felt heavy. But this is also very important. Women tend to experience angina differently than men. They might have more nausea or heartburn, or just unexplained fatigue, feeling run down, doing their normal activities, or even having low back pain or back pain. And some other weird symptoms of angina is actually tooth pain, like the jaw pain. I had some of the nurses that I've worked with say that they knew of dentists that had people come in saying that they had tooth pain, but there was nothing wrong with the tooth. It was actually something going on with the heart. So basically, I always like to say, if you think something is wrong, speak up and don't be a hero. It's okay for something to be wrong, and time is on your side if you are feeling any of these symptoms, especially as women, since we experience it or can possibly experience it differently than the quote unquote normal symptoms. It's really important to take care of that. Okay, so I'm going to stop for a second. I will talk about blood pressure. I just hope we're doing good. If you need me to slow down, if you need me to answer any questions, please help out and write something in. I'm just comments now. Well, I appreciate you all. Thank you for coming, Kate. And yes, Katrina, we all love EKGs. So I will continue. So blood pressure. We all hear about this. Oh, hello to Erica too. We all hear about blood pressure. We all need to manage our blood pressure. We hear that 120 over 80, but what does it even mean? So blood pressure is the pressure that is on, as you can see with these arrows here, that's pressing out onto the walls of the arteries. And if you have too much pressure there, it can cause damage, it can cause inflammation. And if you remember back to what I was saying about the plaque forms there due to the inflammation. So we want to try to keep that blood pressure lower because we want to reduce the inflammation and reduce the work that the heart has to do to pump out the blood to your body. So if we have the example of 120 over 80, those are two different pressures. The mmHg there, that's millimeters of mercury. So, and that's just a way to measure pressure. So that top number, that 120, that is actually the pressure on the arteries when the heart is pushing out blood. So if you think about it like a hose, this is actually the analogy that I really like. Your arteries are like a rubber hose. And when you crank up the pressure on the hose kind of, the water pushes out onto the hose. So the pressure increases when the liquid is pressing on there. And if you have a rubber hose for a really long time, it can crack and it can kind of break and everything. So that is the analogy for why it's important to manage your blood pressure. But anyway, then the bottom number is actually the pressure on the arteries when the heart is relaxed. So we got that boom, 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 boom. So the top number is when the ventricles are pushing out, and the bottom number is when the ventricles are relaxed and filling up with blood again. So that bottom number, it doesn't change very often. And if it does change, then that might mean that your arteries are more relaxed or your arteries are more tense. So I will go on to the next one. I don't know if we can see this very well. I'll bring my little contraption a little bit closer. Okay, so a normal blood pressure, the top number, systolic, is less than 120, the diastolic less than 80, and that is actually fairly new. Doctors have become more aggressive in treating blood pressure because we want to keep that damage and that inflammation down. And when I say we, I'm totally not a doctor. But then when your blood pressure starts, your resting blood pressure, I must add, when it starts to get higher into the 120s, into the 130s, that is when a doctor might recommend, I'm going to move this farther away from my face now, a doctor might recommend that you start making lifestyle changes, which I will talk about in a moment. Then as it gets higher and higher, it gets more and more dangerous for you. So the way that we would take blood pressures at cardiac rehab and the way that we do at joint effort is to have someone sit quietly for about 5 minutes. And a lot of times, a lot of us do have white coat syndrome or blue polo syndrome, and you get nervous when your blood pressure is being taken. So when you're nervous, your blood pressure is higher. So usually we'll take it 1 or 2 times after letting you sit and stay calm for a while. And if it stays in that 140, 160, even 180 range, which would be really scary, we probably won't let you exercise. So going into why it's important when you manage your blood pressure, if your resting blood pressure when you're sitting, let's say it is 160 all the time, doesn't go down. Maybe it'll get down to 140 after you take your blood pressure meds, let's say. It's going to be higher when you stand up. Let's say it's 160 when you're sitting. When you stand up, it might be 165. When you pick up those heavy boxes, it might go up to 180. When you're shoveling snow, it's actually the cold actually causes your arteries to restrict when it's cold outside. Which increases your blood pressure even more. And your blood pressure increases when you exercise. But that increase is okay. But if you're resting, we take your resting blood pressure your first day at joint effort, and it's 160 over 90. We're going to be worried about you exercising because it can, your blood pressure will increase again, and that can cause some problems for you. Namely, there's a possibility of your heart working too hard, and if you do have a blockage that you're not aware of, you could, feel some of that chest pain. It could also put you at risk for a stroke if your resting blood pressure is normally really high. So I have pictures of, or diagrams of, two different types of stroke here. And when your blood pressure is too high and really pushing into those blood vessels, it can cause a brain bleed or a hemorrhagic stroke. And then there's also the stroke when like a blood clot like blocks the artery. That one's different. Blood pressure might not affect that one too much. But your heart is working harder when your blood pressure is higher. So that's just why it's important to be aware of your blood pressure and to learn how to manage it. So, something that is going to be a running theme in this presentation is, how do you manage these things? Diet and exercise. And we had a wonderful presentation by George about diet last week, I think it was, and it's really true. Managing your diet and figuring out what works for you is going to really help manage your blood pressure. Losing weight does help manage your blood pressure, so eating smaller portions and having less sodium is going to be helpful. I have a diagram here of the DASH diet. DASH stands for Dietary Approaches to Stop Hypertension, and it really focuses on having a lot of fruits and vegetables, having whole grains, like things high in fiber, having a lean protein, but not too much of it, and limiting your fats and sweets. And then also exercise. I have right here that it relaxes the blood vessels. So I haven't talked about this yet, but when you're exercising, the blood is moving faster through your body. So I talked about that inner layer of the artery that has receptors in it. And if the blood is rushing past those receptors, it actually releases a nitric oxide that causes those arteries to relax a little bit. So what we would do at Cardiac Rehab, we would take everyone's blood pressure before they exercised, during exercise, and after exercise. And normally their blood pressure would be lower when they started after exercise. Or at least that is what we would look for, to be slightly lower. So that means it's a great response, and it is really, really important for you to cool down after you have been exercising. If your arteries are relaxed, if they're dilated, blood can pool there, especially if you're not using your muscles, let's say in your calves. If you just stand still after a really intense workout, the blood can really pool in that area because all of the blood vessels are dilated, and nothing is pushing the blood back up towards your head. So that's just something that I always like to talk about too. Definitely important to keep moving after you have exercised. So the exercise relaxes your blood vessels, and over time, your blood vessels get used to that. So that's super important. It also just causes your body to create more of those capillaries that I talked about in the beginning as well. Stress management is super, super important for managing your blood pressure too. I talked about how we have, white coat syndrome. We get nervous and our blood pressure is higher. When you're stressed, when you're anxious, when you're really worked up, your blood pressure is higher. So learning how to manage that can help manage your blood pressure too. And lastly, it is not a problem to be on medications. I have talked to a lot of people, who are having trouble with their blood pressure and are really reluctant to try medications. There's nothing wrong with starting a blood pressure medication to start to manage your blood pressure and help take some of that work off of your heart. So some of these medications are beta blockers, which actually decrease the rate at which your heart pumps. Diuretics, which actually get rid of the water in your body. And I totally didn't mention this when I said have less sodium. When you have a lot of sodium in your diet, you hold onto water. So water follows that sodium. So if you have less sodium in your diet, you'll have less water in your body, and your heart won't have to work as hard to push that water around your body. Then there are two others called ACE inhibitors and ARBs or ARBs. Those are things like the ARBs are like losartan, and ACE inhibitors are I can't remember anymore. That's what happens when you don't talk about it every day. I'd have to look that one up. But if you are on lisinopril. Lisinopril is an ACE inhibitor. And if you're on that and you find that you have a cough that just won't go away, that's something that you would want to talk to your doctor about possibly switching to a different blood pressure medication. Then there's also calcium channel blockers, which help to relax the contracting of the heart and of the blood vessels as well. And those ACE inhibitors and ARBs work at the kidney, again, to make sure that you're not keeping as much water on you. So there's a lot of different things that come into play with blood pressure. And I think we are moving on to my favorite, cholesterol. I love talking about cholesterol because, again, when I first really learned what cholesterol was, I was like, wow, I didn't it's been the media just puts cholesterol in such a bad light, and it really is not all bad. Cholesterol is a fatty substance that's produced by our bodies. So we literally it's only in animal products, and it's really important for the structure of all of your cell walls, as well as the makeup of important steroid hormones. And I have that kind of in caps because it's cholesterol and then steroid, they go hand in hand. So if you didn't have the cholesterol that you needed in your body, you might not have enough testosterone or estrogen. So that is something that's important to have. So we need to have some cholesterol in our body. Now, when you get your blood drawn for to look at your cholesterol, you're going to see total cholesterol, HDL, LDL, and triglycerides. Now, HDL and LDL are the good and the bad cholesterols, which I will talk about in a moment. And the triglyceride is just a free-floating fatty acid that is going through your blood. I also have the cholesterol levels here. I'm not going to go into them, but if you're interested in what normal, borderline high, and high are, I can tell you about it in an email. So I have made this diagram that I have been very happy about. And I actually learned about this theory from one of my professors at Southern, Dr. Robertson. He was wonderful. And he was telling me about how the HDL and the LDL, it's a lipoprotein. So what the blood is measuring is this protein that's carrying the cholesterol through the bloodstream. So we have the high density lipoprotein, which means there is a little bit more protein than the cholesterol in this little symbiotic relationship. And there's the low density lipoprotein, which means there's more cholesterol than protein in this little, little molecule. So they're like these little ships that carry the cholesterol to different places. So the HDL, I don't know if you can tell I wrote protein and cholesterol there. The HDL brings the cholesterol to the liver to be processed, and the LDL just kind of stays in the bloodstream. So the LDL, it's a fat that stays in the bloodstream and doesn't really go anywhere. So when it is too high, you just have a lot of stuff, a lot of fat that's staying in your bloodstream, not going anywhere, and it can actually, quote unquote, go bad or go rancid. The scientific word is oxidize. So, if you have, let's say, whole milk that goes bad, or sour cream that goes even more sour, that is the fat oxidizing in that thing. So, in that fatty product. So this LDL can actually oxidize in your bloodstream, and that just causes more inflammation in your arteries. So that's why LDL, L is for lousy, that's why that is the bad cholesterol. And then HDL, H for happy, that is the good cholesterol, because it takes the cholesterol away and brings it back to the liver to be processed. So that is just my little spiel about cholesterol. And there is actually a lot you can do to manage your cholesterol. Now, I did put a big X on top of that alcohol. I don't mean you need to cut it out completely, but decreasing your alcohol intake can really help. So when you eat sugars, your body can only store so much sugar as sugar. Your body has to process it, change it into a fat to store it if you're having excess sugar. So alcohol really is just sugar, unfortunately. And since it provides no nutritional value, taking down that alcohol level can really help to manage your cholesterol. And also increasing your soluble fiber is super important. Soluble fiber actually helps to help you excrete the cholesterol. It combines with it in your intestines. The soluble fiber combines with the cholesterol in your intestines to help you get rid of it. That's like the Cheerios saying that they help lower your cholesterol. It actually does. And things like soluble fiber are like beans and legumes, barley, oats. And I see Shannon here saying eat less meat. Yes, that would definitely help, and that goes along with increasing your healthy fats and limiting your unhealthy fats. So meat is an animal product, and meat has cholesterol in it because all animals create cholesterol. So when you eat cholesterol, it doesn't necessarily mean that you're going to hold on to that cholesterol. If you don't eat it in excess, your body can process it and take care of it. But if you're having more fats that are liquid at room temperature, that can really help to not have that solid at room temperature, those solid at room temperature fats in your diet or in your body. The chemical makeup of those fats, like butter or things with cholesterol in them, or even coconut oil, pretty sure palm oil too, those are solid at room temperature, and those are not as healthy as the olive oil or other fats. So that is something to help manage your cholesterol. Also, portion control. I told you, diet and exercise, portion control, very important. Oh yes, I see Kathy saying eating avocado. Yes, that is absolutely a healthy fat. I also see Pat Darrigan, hello guys, saying to eat steel cut oats. Absolutely. Those are all really helpful to manage your cholesterol. As well, exercise can help with managing your cholesterol. It actually helps your body produce more HDL, which is super important. Like I said, the HDL brings the cholesterol to your liver to be processed. So that's great. And then again, medication. Some people are just genetically overproducers of cholesterol. So having to be on a statin drug, you just might need to be. It could just be genetic. And statin drugs are like Lipitor. They help either help you not produce as much cholesterol, or they help you get rid of it easier. But I do just have down there, if you haven't heard, they can cause unexplainable muscle aches and pains. So that's just something to look out for if you're on a statin drug. Now, stress. How does stress affect my body? This is really important to me. If you guys were watching last week, my wonderful friend Katie Kavanaugh from Feel Your Light talked about, managing your stress, finding peace, finding a way to stay positive, and did a little bit of a meditation for us. I have a little picture of this woman here that is wondering if she's meditating correctly. It's really hard to meditate. It can be hard to meditate, but breathing is easy. That's what I put down there. Just breathing deeply can help to manage your stress and can help to slow your heart rate, lower your blood pressure, etc. I'll get more into that in a moment. But when you are stressed, this is something that I also really loved to talk about when I was working at Cardiac Rehab. Your fight or flight syndrome is turned on. And this was really good hundreds and hundreds of years ago when you would be chased by a saber-toothed tiger, and that all those stress hormones would be in your body. You would be able to run away. You'd get away, and then the stressor would go away and your body could shut down. Now, your blood pressure has to be increased when you're running away from that saber-toothed tiger. Your heart rate has to be increased. Your stress hormones like cortisol are increased. All that adrenaline is pumping through you, and that's awesome in the short term. You really need that. But when it's happening all of the time, when your nervous system is always on, that can really increase your inflammation. And we already talked about with your blood pressure, when that's increased, that increases inflammation too. So learning how to manage that is really important. So Kate did just say there's no wrong way to meditate, and that's completely true. Just starting to sit and breathe and trying to let those thoughts go through your brain without judgment is really all that you need to do to help to manage that stress. And one last thing I wanted to say about this is that I would do actually 5-minute meditations on Tuesdays when I was in cardiac rehab. We would have everyone meditate before their exercise, and if someone normally had like a higher resting blood pressure, like in the 140s or 150s, a lot of times after the meditation, their blood pressure would decrease significantly. Everyone's really, if we tried it, and even we would see all of their heart rates go down and everything. It was really quite a phenomenon. I really enjoyed that. Come on. Okay, so to recap, and I think I have enough time for questions too if we do have any, but what are the steps that you can take right now to better your heart health? And I know I went through a lot. It could feel pretty overwhelming, and hearing lifestyle adjustments and diet and exercise, it just feels like so much, but it's really not. Just taking one step, doing one thing out of the billions of things that I talked about today, doing one thing is going to help put you in the right direction. So, we're all kind of at home, not really doing anything. So getting and staying in your exercise routine is really going to help you with your heart health. Making those lifestyle adjustments and being consistent with them. and making those healthier diet choices, the lower sodium, increasing healthy fats, limiting alcohol, decreasing your portions, increasing foods high in fiber, all of that. And taking a little bit of time to just breathe and try to be mindful can really help you too. But really, the exercise is going to help you with a lot of this. The exercise can help with the stress management as well. I didn't even think of saying that right now, but it really can. It increases the endorphins in your body. Again, like I said, it increases the capillaries in your muscles. Your body produces more of those capillaries. Even just walking a little bit more than you are right now is going to be helpful. And then you get a little boost. You feel better. You feel better about yourself. You're like, ooh, I exercised. So that's going to be something that can be really helpful. And also, as always, talk to your doctor with any concerns. And this is, I was a case manager. I would manage up to 15 patients at a time as they would cycle through our rehab facility, and I would be talking with their doctors, like I said, with the ACE inhibitor, with the lisinopril, if someone was having a cough all the time, or if they were maybe on too many beta blockers, or they just feel tired all the time and they couldn't do their normal daily living activities. I would really push it with their doctor and say, like, something's not right, they really need to see you, et cetera, et cetera. It's really important for you to talk to your doctor too. And you know your body, you know what's going on with it. Doctors know a lot, but if something's wrong and it's not being taken care of, just be an advocate for yourself and get it taken care of. So if you have any questions, please feel free to email me. I put my email, Danielle at Joint Effort Exercise, on in the comments. I think it should be at the top of the comments. This didn't really make sense now that I think about it, but if you look up the American Heart Association, the Mayo Clinic, they have a lot of good information too. These are actually links, so I can send you the PowerPoint if you're interested. Again, feel free to email me. Those are links to the websites. Definitely just take a look, and if you have any questions now, feel free to type them in. But I hope you enjoyed it. I hope you learned something, and please keep exercising. I will go back to here, and I'll talk to you soon. Goodbye. Thanks for coming.